want nurses' workloads to be fair and just so that you can do your jobs and take care of yourselves and your families, because I know you can't take care of everybody else unless you can take care of yourselves. You just can't. And so as we work to make healthcare spending more efficient in Ontario, I want you to know that these changes will not be made on the backs of our nurses. We'll continue to focus on quality care while increasing accountability and the integration of services. We have to do that. We'll help you do your job so that you feel empowered and you can be effective in your day-to-day role.
We have to push our local representatives to provide us with good services and good jobs.
We invest in home care. We need a plan to pay for it.
Unions not only raise wages for themselves, but they raise wages for virtually everybody who's in the workforce, and they wind up having a dampening effect by decreasing economic inequality.
And I just want to thank all of you for what you do every day for the community.
We went around the clock to get people before shift, during the day, after work, before shifts, whatever we could do, we did it.
I just wanted to welcome you all here. This is an exciting time for you as leaders. I'll remember back about, how many years ago would it be? About 34 years ago when I went to my first labor school. I'll never forget it. It was in Toronto. And I walked in there and I didn't know a soul. And I left there at the end of the week going, yes, ONA, and I want to be part of this great group.
What message you guys are hoping to get through to the premiers?
Well, the message to the premiers is that we need Harper to step up to the plate and negotiate out a new health accord so that we, the nurses of Ontario, the nurses of Canada, and all of our patients across Canada can have quality health care. That's the main message. We're also very concerned that we need a fully covered national pharmacare program.
Tim Hudak, leader of the Ontario Conservative Party, has said that if elected, he'd make radical, American-style changes to Ontario labour law, including passing laws that throw out something called the RAND formula.
right. You have the right to collectively bargain. How is it that the men that are working in public service, legal profession have that right, and us as women, predominantly women in the legal aid society, are unable to have that right?
Without you, it's more difficult for us to communicate the value of the plan and speak face-to-face with the membership.
I can assure you that we can still fill Cox Coliseum 5 times with the number of people who live in poverty and Hamilton.
We have not seen a single merger of any healthcare facility with another one that has not resulted in some form of either program or service cut.
The provincial government and all three parties see Scarborough as the most crucial political battleground in this next election. And that means everybody who works in Scarborough and lives in Scarborough, your voice is magnified many times. Each and every one of you has an amazing voice that this government is going to have to listen to, and that all the politicians. And so please raise your voices together.
So our first stop today is going to be at Fast Balkasoon MPP office. We need to make sure that all of the MPPs that we are going to be visiting today realize that we vote, and we need to remind them all that we will vote, and that cutting services in our community is a very big election issue.
Already at the Scarborough Hospital, we've had hundreds of layoffs this year. That's eliminations of frontline worker jobs. RNs, clerks, porters, servers, everybody. We have to stop more cuts from happening.
Stop the cuts! Save our services!
We're just asking you to be able to go to work every day and these cuts are too deep. We've cut to the bone, we're now cutting the bones off. We need the services for our community, for our families, for our friends.